Welcome and thank you for joining part 2 of Seyfarth's micro-webinar series, Hot Topics in Employment Law for Massachusetts Healthcare Organizations. This installment of the series will focus on workplace violence prevention. All participants are in listen-only mode. You are encouraged to submit questions throughout the program using the Q&A feature in WebEx. However, if your question is not answered, our presenters will follow up with you directly in the days ahead. For those interested in CLE credit, an attendance verification code will be read during the presentation. Please write this code down. It will not be repeated and is required for CLE credit. Copies of the webinar recording and materials will be distributed to attendees following the presentation. At this time, I'd like to turn the program over to Adam Young. Adam, you may begin.
Yes, good afternoon, everyone. My name is Adam Young. I am a partner with Seyfarth at the based in the Chicago office. We have a workplace safety and environmental team that has 11 different members around the United States. So I'm a partner with that group. We're here to talk about workplace violence today. And as David said, if y'all have any questions at any time, please feel free to type those into the chat. You know, we're talking about violence. We're talking about programs. If you have a question, but you're asking for a friend, you know, that's fine too. And we're happy to provide you these slides. They'll be available on our website. We're not going to be reading from the slides, you know, because that's generally pretty boring. They're kind of just a guide to our discussion. Answering questions is more of what we do every day, you know, as lawyers that provide advice. So I always like as many questions that come our way as possible. What we're going to talk about today, you know, what is workplace violence? How's it defined? What are the issues and trends we're seeing in healthcare? What are the other types of liabilities that are out there associated with workplace violence besides just the safety and health components? And then finally, you know, what are the practical tips? How are employers putting together programs to address this issue? And we're very pleased to have Lisa Barrett with us, who's an in-house counsel in the industry that's going to be sharing some of her perspective and experiences as well. If we can go to the next slide, please. All right, so statistics on workplace violence, you know, there's a lot of general statistics and a lot of dated statistics out there. These kind of show you the spend on workers' comp and what types of workplace violence accidents and workplace violence incidents are occurring out there. I think right now we're seeing an environment with very low unemployment, big staffing concerns, particularly in nursing and some related positions in the industry. And we're hearing from clients, well, we used to have one workplace violence incident a month or so. Now it's daily, or it's every shift of a certain unit. Post-pandemic, we think that there's a lot of anxiety among employees. There's also a lot of anxiety and built-up frustration among the patient population and visitors. You've got someone who's, let's say, in the ER for 8 hours instead of 3 hours. Maybe things change then. And I've heard, unfortunately, that exact story. Like, well, the patient seemed totally fine in the ER, and then at hour 8, he got up and he knocked the teeth out of the security guy. So, you know, things can change for the worse for sure, and a lot of that is motivated or driven by certain staffing concerns. All right, if we go on to the next slide, please. So I do OSHA. I'm an OSHA defense lawyer. I look at the OSHA 300 logs for hospitals all the time. It's very rare that I'll ever see a log where there's not workplace violence incidents that are on there for an entire year, because you know, hospitals are pretty big. They have a lot of employees, and there's a lot of injuries and illnesses that occur. Needle sticks obviously is going to be very common, but you see workplace violence always as well. These figures show, you know, of fatal workplace injuries in hospitals. A pretty good chunk of those are from violence. It's a bigger chunk of the fatal injuries than it is just of the worker injuries, which are typically going to be driven by MSDs, musculoskeletal disorders. But it's an important component as well. And unfortunately, the Bureau of Labor Statistics had a little bit dated data from a decade or so ago. I bet if you redid these now, violence would be a bigger chunk of the pie, both of injuries and of fatalities. And you know, we've had clients where, just anecdotally, there have been tons of very serious injuries and active shooter situations at hospitals. I think that's probably driving higher numbers in that respect. We go to the next slide, please. All right, so defining workplace violence, this is a definition from SHRM, which I think is very helpful. It's a little bit broader and more encompassing than OSHA's definition and some other folks' definition because it focuses on threats and attempted issues rather than just actual physical violence. Because a lot of the workplace violence incidents that start with those threats or attempts that can later progress into something more concerning. There's 4 different types of workplace violence, and I think a lot of times we're in the hospital context, we're just trying to zoom in. We're zooming in on type 2. We're worrying about patient violence, worrying about visitor violence. But there's a lot of workplace violence where individuals have no connection at all to the workplace. The active shooter situation and the grocery, those sort of things. A lot of times that individual has really no connection. Type 3 is violence from a current or former employee. And we see tons of those at our clients, right? And we see a lot of complaints. Well, this employee is saying strange things and he's being terminated because he's not doing his job. And he put a target on the back of his high visibility vest and says, I have a target on my back. What should we do in those types of situations? Because current employees, former employees, big source of workplace violence. And then finally is individuals who have a relationship with an employee but don't have a connection to the workplace otherwise. So a lot of domestic violence can bleed into the work site. Unfortunately, on the south side of Chicago, there was an estranged former boyfriend recently that came and shot and killed an employee in the parking lot, right? So that's kind of a domestic violence situation that bleeds into the workplace in that way. So go on to the next slide, please. All right, so OSHA enforcement. Federal OSHA does not have a workplace violence standard. 23 states have OSHA state plans that regulate private employers in those states. Vermont, for instance. Massachusetts is federally regulated. The third most active office in the United States is in the Boston area for OSHA. They're very aggressive. They're engaging a lot of enforcement. And workplace violence is this big expanding issue for them. I met with the director of federal OSHA in March of this year, and he said the number 3 priority for the agency for 2022 was workplace violence and workplace violence enforcement. So they don't have a standard, they don't have regulations, but they do have a general duty clause. And the general duty clause requires employers to provide a workplace that's free from any recognized hazard. And that's what they assess workplace violence citations under. Doug Parker, the head of federal OSHA, used to be head of California OSHA, and they have a healthcare workplace violence standard or regulations out there. We probably will be seeing a workplace violence and healthcare standard from the feds. They say they're working on it, but it's backburnered. They have a healthcare COVID regulation they're working on now. They have heat illness regulation as well. So the same folks who will be doing the workplace violence regulations, I think, have other priorities at the moment. I understand there is pending Massachusetts regulation. It's an act requiring healthcare facilities to develop and implement programs relating to workplace violence. And that's been promoted by the MHA, the Massachusetts Health and Hospital Association, which is trying to address, steps that are proven to proactively prevent workplace violence incidents. If we go on to the next slide, please. All right, so there's a lot of different legal issues that are caused by workplace violence. Workers' comp, right? If your employees are injured, they could bring workers' comp claims. Typically, if it's your employee, workers' compensation is the exclusive remedy they can get. But if it's not a employee of yours, if it's a visitor who's injured, if it's a contractor, if it's a delivery person, there could be a range of torts that are brought as well, such as negligent hiring, retention, supervision, training. Those are all potential torts as well. And I'll turn things over to Chris, who's going to talk a little bit about other employment claims.
Thanks, Adam. So I want to talk about 2 federal statutes in particular, Title VII of the Civil Rights Act, and on the next page, we'll talk about the Americans with Disabilities Act, because these clearly come into play when we're talking about workplace violence, even if it's violence perpetrated by, non-employees, we're talking patients or whatever it may be. So generally, Title VII of the Civil Rights Act requires healthcare employers and all other employers to protect their employees. But healthcare employers must protect their medical staff and employees from harassment, discrimination, and other unfair treatment in the workplace. And they need to respond to it promptly and effectively when it comes up, even if we're talking about patient harassment. Title VII, as many of you know, is enforced by the Equal Employment Opportunity Commission, the EEOC, which is a federal agency. So most of the time we're talking sexual harassment or what's called hostile work environment. Hostile work environment is a type of harassment that we see in healthcare settings when it comes to especially patient violence situations. Hostile work environment is where a supervisor, coworker, or third party, such as a patient, interferes with work performance by creating an intimidating, offensive, or hostile work environment. Typically, this means a physically, sexually, or verbally abusive environment. The unwelcome conduct must be, it's called the severe or pervasive standard. It's in a lot of case law, but it must be severe or pervasive to create an abusive working environment, which means it could be one instance of severe misconduct on the part of a patient, or a series of less severe instances of, verbal abuse, sexually suggestive abuse, grabbing, that type of thing. Regarding patient harassment, the employee, in order to make a claim, for instance, usually we're seeing this in the context of employees making a claim saying my employer didn't protect me under Title VII. With respect to patient harassment, the employee must show that the employer knew or should have known about the hostile work environment created by the patient, but failed to take prompt remedial or corrective measures. So what should employers do? Among other things, generally employers want, to avoid liability under Title VII, want to establish and communicate clear policies for raising concerns about harassment and hostile work environments specifically. Respond to and investigate complaints of harassment promptly and, take corrective action. And train employees, of course, and as Adam and Lisa will discuss, training employees on dealing with violent situations, dealing with patients, and notifying employees when they may have a patient with a history of violence or who may have a propensity for violence. The slide here references ACA Section 1557 as well. That's the non-discrimination provision of the Affordable Care Act. It closely relates to what we're going to talk about on the next page, and also the Rehabilitation Act of 1973. But generally, the ACA Section 1557 and the Rehabilitation Act of 1973 prohibit discrimination by private organizations that receive federal funds. So to the extent you may not be covered under either the ADA or Title VII, you might be covered by one of those other two sections. Next slide, please, Dave. So let's talk about the Americans with Disabilities Act. That's the federal civil rights law that prohibits discrimination against people with disabilities. So healthcare organizations that provide services to the public are covered by the ADA, and generally we're talking about, clinics, hospitals, places that accept patients. The ADA requires that healthcare entities provide full and equal access to people with disabilities, and to establish a claim, a person must show that they are disabled under the ADA, that the entity that they're suing is a private entity that operates a place of public accommodation, which is fairly broad and satisfied in many cases. And third, that the individual was denied public accommodation because of his or her disability. A disability under the ADA is a physical or mental impairment that substantially limits one or more major life activities, including the ability to interact with others. It's also a very broad standard. And note that conduct resulting from a disability is considered to be part of the disability. So that disability versus behavior, sometimes it's a very blurry line. Generally, bad behavior absent a disability is not covered under the ADA, but oftentimes the conduct that arises is resulting from that disability and therefore needs to be accommodated, as we'll talk about in a second. So discrimination not only occurs when the entity denies service to an individual, but when the entity refuses to make reasonable modifications to its policies or practices to provide services to disabled individuals. The term here is that the healthcare entities must reasonably accommodate disabled individuals unless that individual poses a direct threat to the health and safety of others. The direct threat analysis, however, is it's a very heavy burden on employers, on healthcare entities dealing with these situations. So it can't be sort of a quick, you know, okay, this person poses a direct threat based on some past conduct. We need the entity needs to conduct sort of a case-by-case assessment in each instance to determine the nature, the imminence, the duration, the severity of the risk, the probability that injury will occur, whether reasonable modifications of policies or procedures can be made that will sufficiently mitigate the risk. So simple, you know, good faith belief that a direct threat is at play is not enough. And there are many examples where courts have held that, you know, the employer really needs to engage and conduct that assessment. And the assessment must include potential future risk, not just that risk happened in the past or that incidents happened in the past. So that's a 10,000 or 20,000 foot view of the Americans with Disabilities Act. I will turn it back over to Adam, and Dave, you can move on to the next slide.
Chris, could you provide the CLE code at this time? I think I don't have it.
Yeah, it is Seyfarth, SS as in Seyfarth Shaw 3655. SS as in Seyfarth Shaw 3655.
Thank you. So compliance with OSHA, if there are no regulations, is going to be based typically on is whether the company, what they're doing, is it sufficient to abate a recognized hazard. OSHA looks to its own guidance first, right? Was the company following OSHA guidance? If you followed OSHA guidance, you're probably not doing something that's insufficient to abate the hazard. So we provided the OSHA guidance here. They also look to the industry, right? What's standard in the industry? What's being done in the industry? There is Joint Commission guidance on workplace violence as well that we'd recommend you take a look at. I want to go to the next slide and turn things over to Lisa to provide a little bit more insight, you know, from the trenches on her experience.
Thanks, Adam. I appreciate that. Good afternoon, everyone. I'm an in-house counsel with Universal Health Services. We're a healthcare management company. We have acute care hospitals and behavioral health hospitals, about 200 across the U.S. And as Adam was saying earlier, the Massachusetts office of OSHA has taken a really aggressive approach in workplace violence. We've you know, from time to time, get OSHA complaints kind of all over the country and have a really good track record in responding to those. And let me be clear, these are type 2 from that earlier slide. This is patient aggression complaints almost always in our situation in our hospitals. And we have a good track record everywhere except Massachusetts. And you know, we've made a lot of efforts to try to comply with this guidance. I want to share today kind of some of our experiences, and hopefully that will help some of you as you're developing your programs and things that you're thinking about. You know, complaints to OSHA, that is, Adam was telling me about a third of the OSHA inspections that are opened come from employee complaints. And, you know, they might also come from maybe you have a high injury rate, and OSHA does look at those and will come out kind of on their own and ask you about those, you know, kind of programmed inspections. Sometimes these are union driven, so a heavily unionized facility, you know, union, especially if they're coming up for bargaining, might use workplace safety and kind of, you know, promote employees going to OSHA to complain about that, to sort of support a general perception that the workplace is unsafe. And sometimes it's just employees that maybe they've been injured, or they're uncomfortable in the work environment, they've had a bad situation, or they're just disgruntled. So they go to OSHA. And so typically how you will find out about it is one of two ways. One would be you get a letter in the mail that says, we've had a complaint, please write up a response and get it to us by a certain date. Those are generally a little bit, we prefer those as opposed to the second way, which is OSHA shows up on your door. And I would say, just as a general rule, it's really important to have kind of a checklist of what do you do when OSHA shows up in the door. And a lot of you may have that already. Some of the things in our plan are, make sure there's a distribution list of who needs to be notified immediately. A lot of times the OSHA inspectors will show up and they'll have this sense of urgency, like we want a tour right now. We demand to start talking to employees. And you do have a right as an employer to have your counsel involved at an opening conference. I think that's really important. I always say, stop, take a breath, put the OSHA inspector in a room, offer them coffee, tell them you'll be right with them. You need to have some, people that you report to. The only thing that has to happen within a certain time frame is turning over the 300 logs. So that's important to start getting that process going. But other than that, that's typically my advice. I don't know if Adam, if you want to share anything on what you advise your clients on.
Yeah, sure. Yeah, we'll have a couple slides where we go through that, and different advice on the policies themselves. Absolutely critical if OSHA does show up on site is OSHA inspection management. Right, we're gonna want to keep that limited and focused as much as possible. We want them, if it's just about the surgical intensive care unit, we don't want them going anywhere else. We don't want them talking to employees from other people. Anything that they hear could be a basis to expand their inspection. If it's about a hazard, anything that they see could be the basis as well. So that's definitely an important element of it.
Yeah, two other things I'd add also is that if OSHA does want to speak to managers, we always, as a company, take the position we must have counsel involved. And they may push back on that or try to talk to your directors independently. But I mean, for us, that's critical. And then if you do a walk around with them, as Adam said, you want to stay limited to whatever it is that they are investigating. But then also if they take pictures of things, you take pictures of things, just so you make sure that you're
absolutely. You have the right to have counsel if they're interviewing a manager. I would never accept pushback on that.
right.
In terms of interviewing employees, too, you can prep those people, right, on telling the truth and on not speculating or guessing. And we have an article on that and a handout in English and Spanish about how to prep those people if anyone ever needs a. Sorry to cut in.
Yeah, no, and just to kind of cover these last couple of points, the enforcement positions, I mean, this is basically when you do get a citation from OSHA, if you do, they call them abatements, and our company has pushed back on some of these citations because the abatements that OSHA proposed, we feel are, as Adam said, there's no regulation, and so it is in our mind too broad. Kind of setting us up for failure, very vague. And so those are some of the things that we've pushed back on. I think just in the interest of time, maybe we turn to the next slide and talk about the workplace violence plan. This
Sure.
is kind of.
Go ahead, sorry.
No, go ahead. Is there something you'd like to?
Oh, no, either way. This is an overview and it's different elements that are in workplace violence prevention programs. And I don't know that we need to get into all the details. We'd love to hear more from you, Lisa, as to nuances that have been important to you.
Sure. So, our history with OSHA and workplace violence, as I said, it started in Massachusetts and is probably 8 to 10 years ago that this happened. And I think where we really got off on poor footing with OSHA is that in our environment, especially in our behavioral health facilities, we don't refer to patient aggression, that type 2. We didn't historically refer to that as workplace violence. That to us was, had clinical terminology like managing patient aggression and managing the milieu. So I think for those in healthcare, that's there's more industry jargon that doesn't necessarily line up with workplace violence. And so when OSHA was asking us for our workplace violence plan, and we had HR handing them the plan that really address kind of coworker or outside shooter, all those of the other types, but not necessarily patient aggression, because those were clinical policies. So we've adapted our workplace violence HR policy to say this does not encompass everything that we do around managing patient aggression. Those are clinical policies, and you might make references to them in other places. Some other lessons learned for us is, we as a healthcare organization talk about patient safety all the time. It's our number one goal. And what we realized, again, from some of these employee interviews is we're not talking the talk enough about employee safety. We had all the programs in place, but we weren't sharing with employees, these are the things that we need to do, that we are doing to keep you safe. And so I think that's a really critical area where HR can have some influence, is making sure that whether it's postings, and in our organization, those kind of come from our loss control department, just really making sure we are talking about the things that we're doing, and making sure employees are aware.
I can tell you that the California standard really encourages employee involvement in the program itself. So having safety committees where employees, are communicating what they're concerned about so they can be addressed. So much of workplace violence and programs is about being proactive, where OSHA cites employers typically is that there were a lot of complaints coming in relating to workplace violence, and the employer wasn't taking sufficient steps to deal with them. A real seminal case that's out there and is a great indication of why OSHA inspections and citations matter would be Integra Health Systems. If you went on, you Googled that employer, one of the first hits you're going to get is a OSHA decision saying that a young woman was complaining about someone's home that they were visiting. They're a health services worker. They went out 5 times. The person made them uncomfortable. And on the 6th time when they came back, that individual chased them down the street with a butcher knife and hacked them to death. So I don't want that to happen to anyone who works anywhere, number one, but I don't want you, if you're an employer, to, be that's the big Google response that you're going to get out there. So very important. If we go on to the next slide, please. One of the nuances that I think Lisa and others have encountered is we normally recommend zero tolerance policies that say we can't have threats, we can't have violence. But if you're dealing with patient populations where people are out of sorts, there may be expectations that we're going to occasionally hear things like that, threats and violence, and how do we deal with those appropriately? Because we have to treat those patients, as a society, that's part of our community that needs to be treated. So really crafting nuanced policies is important for those. What are the administrative controls you're going to do? How are you going to train people? What are the engineering controls you're going to have in place? That might be plexiglass, that might be additional staffing in areas where it's necessary, where you think there's a real risk. So all important points there. If we go to the next slide, please. This talks about other requirements that are out there to help prevent workplace violence, help prevent OSHA citations. Always recommend clients have mandatory safety concern reporting. Absolutely, if you don't now, get a mandatory injury reporting requirement. As soon as an employee is reasonably aware of an injury, they need to provide a report of that. That's going to prevent, a variety of different legal issues down the line. You have to have OSHA Form 300, so you got to be logging incidents correctly. California, in their standard, requires a workplace violence incidents log that's separate from your OSHA 300 log. And some of our clients have rolled that out nationally. They like it. They like having this separate log. They like knowing what's going on from that perspective and tracking it. Drugs and alcohol are often very heavily associated with workplace violence. So a lot of our clients do post-incident drug testing following workplace violence to see if there's some issue there. Employee assistance programs, obviously people suffer from mental health conditions. We want to keep valued members of our client staff available there if possible. And maybe that's a way you can proactively address issues that might later result in workplace violence. All right, let's go on to the next slide, please. I don't see any questions that we should be answering at this time, but this is different, action items and different areas that people might want to work on. If you don't have a written plan, obviously get a written plan. De-escalation, we were talking about earlier, is just so critical. Making sure that particularly your security staff is trained to de-escalate, and rather than using, physical violence, so they can avoid it. And responding to concerns proactively, very important as well. If we're going to the last slides, we're almost running out of time. I just want to talk about there's certain problem sources that we see again and again. And one of those is mishandling terminations or discipline. If an employee does the employee-directed violence or former employee-directed violence, if they're making violent threats, they're making complaints, or excuse me, they're raising concerns, they're threatening violence, you have any reason you think they're going to be violent, they don't need to return to the hospital to be terminated. That can be by Zoom, that can be by a phone call. There's no reason why you would need to do that in person. You know, we had a mass shooting out here in Aurora, Illinois, where they did an in-person termination with someone who had made threats, and he pulled out a gun and shot the HR intern dead. Wouldn't want that to happen to anyone. So that's an easy low-hanging fruit, I think, that a lot of employers can address by not mishandling those sorts of terminations or discipline. But these are all important areas of problem sources out there. If anyone has any other questions, we're happy to answer them. We have articles, we've done policies for workplace violence. If there is any safety or health issue you ever have, I could probably say we have an article on it out there. Thank you so much for attending, and thank you again, Lisa. We really appreciated hearing your insights. And Chris, I don't know if you have any other thoughts.
No, thanks very much, Adam, and thanks again for your time, Lisa, and have a great day, everybody.